our service capacity, staffing levels, and ultimately the availability of our programs that individuals and families rely on every day.
Well, some healthcare providers in Louisville are concerned about their budgets as they prepare for the impacts of sweeping federal cuts to Medicaid passed last year. Democratic Congressman Morgan McGarvey of Louisville hosted a roundtable discussion today in West Louisville.
It was over at the Goodwill Community Center in West Louisville, where we also heard firsthand from people worried that essential programs could take a hit on this. Our political reporter Isaiah Kim Martinez and photojournalist Connie Offit have the story.
I have a girlfriend I love, and I like being independent.
Brandon Ramos wears his heart on his sleeve and is proud of the life he's built.
I know how to cook, and I know how to clean, and I always help people. I like helping people out a lot.
A panel of elected officials and healthcare leaders listened intently as Ramos highlighted the work of the nonprofit called Down Syndrome of Louisville, which has provided him and so many others essential services like education and job opportunities.
They rely on ongoing therapies, medications, and long-term assistance, so even temporary gaps in coverage can create real challenges.
The group's executive director, Taylor Ingram, stressed the obstacles they're facing more than a year after Congress passed President Trump's One Big Beautiful Bill Act, known formally as H.R. 1. The law came with cutbacks to federal Medicaid funding.
Medicaid results in about 60% of our annual revenue. So any cuts will ultimately impact the availability and quality of services.
It also requires certain recipients meet a minimum number of hours worked per month, document it, and renew their health care coverage more often. Democrats argue the extra paperwork is burdensome and will force more people to go uninsured.
H.R. 1 is one of the biggest reverse Robin Hoods we have seen at a national scale. It literally takes from those who have not and gives more to those who have.
But Republicans like Congressman Brett Guthrie say the point is to root out waste and fraud and ensure Medicaid only covers those it was intended to help. In July, he told us this in Washington.
But the real problem in these international cartels that are just signing people up for Medicaid, not performing any services, and just bilking the government, which robs the taxpayer, but it also robs the person who truly the Medicaid is for.
Meanwhile, some healthcare providers feel trapped in the middle of all this, now racing to find new sources of funding for their staff.
I like to help you, all of you guys, right here, right now, because I love you.
And the families they serve. Isaiah Kim Martinez, WHAS 11 on your side.
Nonprofits like Down Syndrome of Louisville say they don't expect to feel the impacts of the Medicaid cuts until next year.
But they're already having to look forward, boosting private contributions, community support, and grants.